So I would say the question regarding the biomarkers integration in prostate cancer. So as you know, one of the first biomarkers that we actually have been tested in cancer period was acid phosphatase, and that was one of the earliest biomarkers in based on the work from Huggins and Hodges in the earlier part of earlier part of last century in the 40s and the 50s, and we continued to use them. As you know, biomarkers can have different profiles, so they could be predictive or prognostic. And in reality, if the question is relating to predictive biomarkers, which basically is if the tumor has this specific alteration, it is likely to respond to this particular drug, the answer is yes, we have lagged behind. However, we're catching up because now we have multiple trials ongoing looking at patients who have DNA damage repair defects, where they're being selected for PARP inhibitors, for example. But with regard to actually use of biomarkers as it relates to risk prediction, as it relates to relapse detection, PSA is the biomarker, and it's been used quite widely. I would say from the early detection all the way to monitoring disease activity, to monitoring response, and so on. So from that perspective, I think it's an okay biomarker. I think we need smarter biomarkers, but we also need to get into the era of predictive biomarkers. So we're not treating everybody like a one-size-fits-all, but rather pre-selecting patients for appropriate treatments.